Testing. Assalamualaikum and a very good afternoon, everyone. Thank you for joining our session today. I'm the MC for today, I'm Nazari. So a bit of housekeeping before we start. Ooh, redundancy, okay. First of all, turn your phones to silent or vibrate if possible. And when the Dean and our Speaker of Honor arrives, everyone will stand to honor them and remain standing for the national anthem as well as the song. And thirdly, there will be some semi-formal photo sessions, but anyone who wants to stay back and take more photos with our speaker is welcome to do so, especially this row. Okay. We will begin shortly in about 5 to 10 minutes, so just hang on. Ladies and gentlemen, I would like to announce the arrival of our Dean of the Faculty of Medicine of University Malaya, Professor Dr. Yang Farida Abdul Aziz, accompanied by Professor Dr. Anushya Vijayananthan, Professor of Radiology, Department of Biomedical Imaging. Please be seated. Assalamualaikum warahmatullahi taala wabarakatuh dan salam sejahtera diucapkan kepada semua hadirin yang dihormati sekalian. Selamat datang ke Syarahan Perdana Profesor Dr. Anushya Vijayananthan pada hari yang berbahagia ini. Untuk menghormati tetamu-tetamu kita, terutama yang menghadiri syarahan ini dari luar negara dan secara atas talian, izinkan saya untuk seterusnya bertutur dalam bahasa Inggeris. Yang berbahagia, Profesor Dr. Yang Farida Abdul Aziz, Dean of the Faculty of Medicine, the Honorable Professor Dr. Anushya Vijayananthan, Professor of Radiology of the Department of Biomedical Imaging, Faculty of Medicine of University Malaya, yang berbahagia, Tan Sri Professor Emeritus Dato Dr. Muhammad Amin Jalaluddin, Professor of Otorhinolaryngology, Faculty of Medicine, Yang Berusaha, Professor Dr. Nazira Hasnan, Director of the University Malaya Medical Center, Management of the Faculty of Medicine, Management of University Malaya Medical Center, distinguished guests, fellow academicians and clinicians, colleagues, future colleagues, family and friends, ladies and gentlemen. I would like to extend a warmest welcome to all of you on this momentous occasion, the inaugural lecture hosted by the Faculty of Medicine, University Malaya. I am Nazri, and I am honored to be the Master of Ceremonies for the inaugural lecture of my teacher, colleague, and friend, Professor Dr. Anushya Vijayananthan, or as she is fondly known throughout the faculty and hospital, Prof. Anu. A professor's inaugural lecture is one of University Malaya's most cherished traditions. This lecture honors the professional journeys taken by our professors and provides an opportunity for them to share their wisdom, inspirations, and philosophies. We are honored to be here today as an audience for the lecture by Professor Anushya entitled The Portrait of a Woman. To that end, I would firstly like to invite the Dean of the Faculty of Medicine, Professor Dr. Yang Farida Abdul Aziz, to chair the lecture and subsequently introduce Professor Dr. Anushya. Please give a warm welcome to our Dean, Professor Dr. Yang Farida.
Assalamualaikum dan salam sejahtera. The Honourable Professor Dr. Anushya Vijayananthan, Professor of Radiology, Department of Biomedical Imaging, Faculty of Medicine, University Malaya. Yang berbahagia, Tan Sri Professor Emeritus Datuk Dr. Muhammad Amin Jalaluddin, Professor of Otorhinolaryngology, as well as previous Vice Chancellor and previous Dean of the Faculty of Medicine, University Malaya. Yang Berusaha, Professor Dr. Nazira Hasnan, Director, University Malaya Medical Center, Management of Faculty of Medicine, Management of University Malaya Medical Center, distinguished guests, professors, doctors, ladies and gentlemen who are joining the inaugural lecture virtually as well as physically with us today. And I think those of you who are physically with us is going to be enthralled by what I would imagine will be a wonderful moment that we are going to be sharing today. It is not often that one gets an opportunity in life to officially talk about someone very close to their heart. In 2020, I told myself I was not going to do this. In 2020, she was the MC for my own Syarahan Perdana. So today, I'm very grateful and proud to stand before you today to introduce to you a beautiful woman and one of my best friends, Dr. Anushya Vijayananthan, a professor and consultant radiologist at the Department of Biomedical Imaging, Faculty of Medicine, University Malaya. Professor Anushya was born at Hospital Kuala Lumpur to Vijayananthan Gulasingham and Raja Lakshmi Rasya. And I think Mr. Vijayananthan is with us today. Thank you very much for being here, sir. She began her educational journey at Azuta Girls' School. I don't know why there's so many of them here. Can you hear that? This is University Malaya, guys. Keep it down. Following that, she completed her undergraduate training at the prestigious Lady Hardinge Medical School, University of Delhi. She then returned to Malaysia to serve, including a stint in Ipoh GH, tending to patients who mistake biawak bites for snake bites, including bringing the dead biawak for Anushya to identify the venom. She then chose Masters of Radiology, and she chose University Malaya for her specialty training. Her upbringing with her father's work in the Selangor Education Department and her mother's career in teaching instilled in her a deep-rooted passion for teaching and learning, which led her to make the choice to return to University Malaya as a lecturer. And I can safely say, we can all agree, that University Malaya and University Malaya Medical Centre benefited from her passion and dedication. At Faculty of Medicine and UMMC, Anushya proceeded to master not one, not two niche areas. She mastered 5, in which she has garnered a robust publication record and has delivered numerous lectures nationally and internationally in, number 1, ultrasound, in particular vascular ultrasound. Following a training stint at the then Ultrasound Center in Mumbai, she now works collaboratively with the transplant team at UMMC, providing dedicated radiology ultrasound service. Number 2, interventional radiology, where she obtained her fellowship at the Gardnerville, I don't know whether that's the correct pronunciation, General Hospital in Glasgow, United Kingdom. Number 3, women's imaging. Garnering the skills she obtained during her training in ultrasound and interventional radiology, she started new innovative services in gynae intervention. Number 4, medical education. In both undergraduate and postgraduate education, she completed the Essential Skills in Medical Education course, earning the SME certificate. She is the department's postgraduate coordinator and the OSCE lead coordinator for the Faculty of Medicine. Both posts she holds till today. And finally, breast imaging, as if, finally after number 4. And finally, in breast imaging, completing a fellowship in 2023, cementing her passion for women's imaging. And guess what? She cooks like a dream too. In her personal life, she is married to Dr. Vijayavelu, Vadivelu, a gynecology oncologist at KPJ Healthcare, who shares her love for outdoor activities. They are blessed with 2 beautiful daughters who are also here today, Vinosha and Sitara. Congratulations, Sitara. Who are bright, strong young women in their own right. She has one sister, Sasha, who has been her rock and pillar throughout the years. Her family serves as her constant motivation to strive for continuous self-improvement, and she pursues her passions fervently across academic, clinical, and personal realms, embodying a dedication to holistic growth. Anushya and I became fast friends over the years because we both did the Masters of Radiology program. One would think it would have been hard to keep pace with Anushya, and one would be right. Except she has such a generous spirit, an open heart, and a caring soul. Just being around her gives you warmth and confidence. Her compassion and support for her students, fellow workers, and patients are endless. And those of us at the department, radiographers and radiologists alike, can attest that when Anushya is in our corner, she has you covered no matter what. Isn't that right? But when she says, please lah, we all know to take a step back. Anushya, I hope you know and feel the respect and love that we all have for you. Professor Anushya Vijayananthan, with a life to the service of others, where little pieces of you get distributed to different things and different people every day. I'm glad we have this opportunity today to focus on you and on your academic scholarship. So with this inaugural lecture titled The Portrait of a Woman, I present to you Professor Dr. Anushya Vijayananthan. The floor is yours, my dearest friend.
Yang berbahagia, Prof. Datuk Dr. Yang Farida Abdul Aziz, the Dean of the Faculty of Medicine and my close friend. Yang berusaha, Prof. Dr. Nazira Hasnan, the Medical Director of UMMC, and my fellow Asunta girl. Yang berbahagia, Tan Sri Emeritus Prof. Dr. Muhammad Amin Jalaluddin, the ex-Vice Chancellor and ex-Dean of the Faculty of Medicine. My esteemed teachers, some of whom have retired and have come here today. My colleagues who have worked in this institution for decades with me. My Department of Biomedical Imaging, who's here in full strength. My students who are my kids at work. My friends, some of whom have traveled from afar. My family, who is here also in full force. Ladies and gentlemen, thank you all for spending this evening with me. I've stood here many times on this same podium to give a lecture or a briefing. Somehow it feels very different today. I wonder why. Over the past 3 months, I've attended 3 wonderful inaugural lectures by 3 brilliant physicians, all 3 very close friends of mine. And they had fantastic stories of their life, heart-rendering stories, really amazing. Some of them even had their patients here. So I went back and I thought, right, what am I going to bring? I could push a couple of computers with the PAC system. I could bring a couple of illuminators with some film. But as you can see, none of that is here. So please bear with me as I tell you the story, a story the radiology way, with pictures rather than words. Many have asked me, as soon as this title came out, can I have my slide? Thank you. When the title came out, The Portrait of a Woman, one of my MOs actually asked me, Prof, are you going to do some women's lib sort of fight, sort of, you know? So it is not meant to be sexist at all. After all, at the end of the day, if you take the WO out, the word man is still there. But it is basically, I was trying to find a word that talked about my radiology life and about myself, but not only about myself, but everybody who's been on this journey with me. I wanted to use the word image, but I use it all the time in my reports, and I just thought, let's change it. So I found the word portrait instead. Now, the most famous portrait of a woman is the Mona Lisa. Just by chance, one of my junior lecturers, Dr. Eric, found a website that had an X-ray of the Mona Lisa done, which is the image on the right. And it showed how Da Vinci painted her layer by layer, starting from a black and white drawing, adding color, and finally, over the years, producing the image or the picture or the portrait on the left, which is the Mona Lisa. So please bear with me as I take you through my layers. Don't worry, I won't take as long as Da Vinci did, but I would like to share with you that. Starting with a bit of my life, I was born in HKL in 1967 to Vijayananthan and Rajalakshmi. I was born in HKL, but my mum had her follow-up here under Prof. Puvan. And Prof. Puvan actually delivered me. But in 1967, the maternity ward here was not built yet. Therefore, I was born in HKL. My early life, if you see on the left, was in a house in Coles Road. So my parents were both government servants, and that was the government quarters. Somewhere in 1971, parents built their our family home, which is now in PJ, and that's where my father resides till today. And this was our little family unit, just the 4 of us, my dad, my mom, Sasha, and myself. My schooling was done in Assunta Primary and in Assunta Secondary School, and as you can see, we have some very loud Asuntarians in the room. That was, I think, a class photo either in Form 4 or Form 5, taken at the Padang in SMK Assunta. And some of these girls are still very much in my life till today. My undergraduate years, or I graduated in MBBS from the Lady Hardinge Medical College in New Delhi. And on the right was my graduation in my Master of Radiology from University Malaya. Now, when I was trying to decide how I was going to talk about my life, actually, and it's not easy to concise 27 years of your life in 1 hour, and I'm going to try to do that. So I think there are 3 parts that I need to talk about. The part of me that's the clinician, the part of me that's the organizer, and the part of me that's the educator. All radiologists start with this slide. This is the man without whom we would not have a job. So this is Willem Conrad Rangen, who discovered X-rays on November 8, 1895, in a laboratory in Germany. And that was a photograph of his wife's hand. And it's known as the picture that changed the world, because honestly, what would the world be without us radiologists? It's a fact, it's a fact. Come on, guys, you have to admit it's true. Right, so thinking about my clinical journey here, I also was wondering how I was going to do this. So I thought modality-based will probably be the best. And I need to start with the modality that is closest to my heart, and that is ultrasound. I always start ultrasound with this slide. And if you look at the top, you can see that the frequency of audible sound, what we can hear, you and I, is in hertz, 20 hertz to 20 kilohertz. And although you go for an ultrasound examination, you can't hear the ultrasound energy, but there's sound energy nevertheless, as it's in megahertz, 1 to 20 megahertz. These are all the animals. I love to start my ultrasound lectures always with this, that use ultrasound energy every day in their life, whether we can hear it or not. And on the right-hand side, on the corner of the right, at the bottom, you can see that elephants are basically deaf. Infrasound, yeah? So Spallanzani was an Italian priest, and he discovered inaudible sound to man. And this was discovered very much earlier in the 18th century, but his work was never published. He discovered, he blindfolded bats and they could navigate in the dark, but when he closed their mouths, they couldn't, which led him to believe that they emitted a particular sound that helped them to navigate, and that was called Spallanzani's bat problem. Now, the Pierre and Jacques Curie, the Curie brothers, started the biggest revolution in the world of ultrasound. They discovered the piezoelectric effect of the crystals. This crystal is used till today in our ultrasound machine. And the effect is that if you heat up this crystal, it vibrates and gives out sound energy. So this was their publication in 1880, the Curie brothers. Now, when you find and you discover something new, you think that it can cure everything. So it was used initially in World War I for surveillance of U-boats, and then they used it for medical therapy. They found ultrasound, let's just use it for everything. They used it for angina, they used it to I mean, the cardiologists must be cringing, but they used it for angina, they used it for urinary incontinence, eczema, all sorts of things. So they used it for therapy rather than diagnosis. However, in 1954, and if you look on the left, that's the somascope, actually would be officially the first ultrasound machine where a man is lying in a tub of water, and it's already been established we need a medium of transmission, and a little image that comes out at the top comes out a lot later. So if technology hadn't moved on, today if you come for an ultrasound machine, ultrasound scan, this is how it will be done. In a tub of water, lying down, holding a film. 3 years later, a little bit more dignified, sitting in a tub of water rather than lying down. And so, because it's computer-driven and technology-driven, they moved in leaps and bounds very, very fast, but always with a medium of transmission. On the left-hand corner is the vaginal A scan, and I will leave those dimensions to your imagination. in the middle was the first real-time scan, which means that when you scan, you get the image. Before that, it never was like that. Looked a little bit like a rolling pin, rolling over the maternal abdomen, and you get an image at least almost at the same time. Now, I started my journey in ultrasound when my then HOD, Prof. BJ, sent me to Mumbai for an attachment in vascular ultrasound for a month at the Thane Ultrasound Center. And I was trained by the renowned Dr. Nitin Chaubal. That's a picture of him and his wife. And I remember the first day that I went to work at 7:30 in the morning, and there was already a line of patients outside. And he said to me, Anu, I have to put you to work. One of my staff is on MC today. And I realized very fast that Dr. Nitin lives on love and fresh air. He doesn't eat. He walks around with one packet of biscuits, half of which he doesn't consume. And at the end of that first day, that center had scanned about 150 to 180 patients. So my last scan was at 9:30 p.m. And while I was sitting down there and scanning this patient with the windows open and the dark sky outside with the full moon, I said to him, can you please take a photo because I need to send this back to Prof. BJ and he needs to know how hard I'm working. This 1 month was invaluable to me because I came back with so much knowledge on vascular ultrasound. And what is Doppler? It brought color to the radiologist's ultrasound image. It gave so much information, the basis of which is the ambulance moving towards you and moving away from you. You can see, you can hear the sound changing. And that was what Christian Johann Doppler used to start, or rather the basis of Doppler imaging. You can determine so many things: velocity of blood flow, direction of blood flow where it shouldn't be, blood flow where it has stopped, where it is supposed to be but is not. And this information is totally invaluable in clinical practice. Thank you to Prof. Shankar for providing me with this data. These are the number of renal transplants done in UMMC, starting from the year 1991. And you can see how we have increased, or rather the urologists have increased in their number of renal transplants. To date, they do about 25 to 35 renal transplants a year. And we are an integral part of that team. Because as soon as the patient comes out of OT, our team is called in to do a Doppler ultrasound to help them with their graft health, to tell them whether they have anastomosed the vessels well, to see whether the vascularity of the graft is good. And we have been a part of this team for an integral part, not only from the renal transplant team, but also the liver transplant team. And my hepatobiliary surgeons are all here today. This is myself and Dr. Waylin scanning a pediatric transplant patient while the pediatric surgeons, the hepatobiliary surgeons, and the pediatricians look on. So our Doppler service is actually a part of this. Now, when you think of 3D ultrasound, I think the only thing that you can remember is how you scan babies and you can see them sucking their thumb and wiggling their toes and all sorts of things. But 3D ultrasound can be used in radiology and can be used very well as well. This is Dr. Leong Suk Sam, and this is a master thesis on 3D characterization of carotid plaques. And these plaques are very important for us to characterize because they talk about impending stroke as well. We also did multiple research papers in breast, and this breast imaging unit is led by Prof. Kartini, who's my current HOD. She's an ardent researcher, and because of her, our department has gone up in leaps and bounds in research. And this is a paper written in 2016, I think, talking about vascular Doppler and breast lesions. Now, like I said, ultrasound is very computer-driven. And because it's computer-driven and computers have moved in leaps and bounds, so has the ultrasound image, or rather technology. We've moved from normal black and white ultrasound to color ultrasound, to 3D, and now to shear wave or elastography. Elastography is simply a way of ultrasound which tries to tell you that if whether or not a lesion you're imaging is stiffer than the surrounding tissue. And we know that lesions that are malignant are about 10 to 20 times, sometimes even 30 times stiffer than normal tissue. And therefore, shear wave elastography, which you see on the right, which took away the human factor and completely dependent on the machine, became very, very important in our clinical work. This is shear wave ultrasound, and if you look at these images, again with color, if you look at this image on the right-hand side here, and you can see that this is a patient which came back to us with a lesion. And if you actually biopsy this lesion, just using 2D, normal grayscale ultrasound, you'll actually be biopsying the wrong area. Whereas shear wave will tell you that that is the stiff portion of the lesion. So shear wave became invaluable in breast. It's already established in breast imaging. It gives you numbers, it guides you where to put your needle, and so on and so forth. Now, these are shear wave papers. Of course, we do a lot of research here. These are my fellow collaborators in the department, and these are the papers that were written for shear wave elastography in breast. Shear wave has also become very important in liver imaging, and we have done a fair amount of research in this, but in liver imaging, it's still ongoing. Because you see, medicine has moved towards safe medicine, and you want to try and avoid doing a biopsy when it can be quite dangerous. And liver is one of those organs that can bleed. So shear wave elastography, in fact, as I speak now, they are moving on, trying to bring about different technology in shear wave so that we do not have to do liver biopsies in the future. And these are my collaborators, Prof. Sanjeev, Prof. Chan, and the late Prof. K.L. Goh, all part of the gastroenterology unit in UMMC. Dr. Leong Suk Sam did her PhD thesis in shear wave of chronic kidney disease. So imagine, we can use shear wave after ultrasound for so many things, and these are all her publications as well. We did a study in shear wave of the endometrium, looking at benign and malignant endometrium, presented at the International Gynae Cancer Society as a poster at that time. And we have very promising results and quite exciting results, and hope that we can continue with this. Our current research in shear wave is for long COVID patients, looking at the stiffness of the diaphragm and comparing it with normal subjects. This study is funded by an FRGS grant, and we hope that we will have some papers out by next year. Now, my next part is interventional radiology. And if you see on the left, there is a hand injected with mercury. You need something which is dense, but that's in a cadaver, yeah, not in a real person. You can't inject mercury in anybody's vessels. So that was the beginning, a first angiogram. And down below that is the Seldinger technique, which all IRs use till today. A puncture into the vessel, followed by a guide wire, followed by a catheter. Charles' daughter performed the first angioplasty and thrombolysis in the US in the mid to late 20th century. And from then on, IR just moved on. Interventional radiology arrived to the Malaysian shores in 1968, when University Hospital, as UMMC was then known, obtained its first diagnostic angio under the Colombo Plan. And the late Dr. Joginder Singh on the left and Dr. Ang were early pioneers who did so many procedures at that time. Dato' Samad, a professor and head of radiology in UKM, fondly known as the father of interventional radiology in Malaysia, took IR to a different level and introduced this to clinicians in our country. So the rest of the gurus that you see there on Prof. BJ, my guru in IR, on the right-hand side. And we established, or rather we started the Malaysian Society of Interventional Radiology a few years ago. And at the bottom is Dr. Josephine Subramaniam, Dr. Jayalakshmi Mahadevan, and Dr. Alex Tang, all past presidents and excellent IRs in our country. In 2005, I went to Guard Naval General Hospital to do my fellowship in interventional radiology under Dr. Richard Edwards. That's him in the middle. Guard Naval General Hospital was at that time the lead interventional radiology hospital in Glasgow. but I was also trained by Dr. Ian Robertson and Dr. John Moss. So what does an interventional radiologist do? I wrote an article in MMA. We can do anything that's image-based. And when I was trained, we started very early doing image-guided biopsies by CT, by ultrasound. We do vascular access. We can drain abscesses. We can drain effusions. We can do embolization. But today, the youngsters who are taking our IR service to fantastic heights, led by Dr. Ng Wei Lin in our department, do interventional oncology, where you can deliver chemotherapy agents right to your tumors from a puncture in the artery. Now, when I started IR, the one thing that I was totally attracted to was uterine artery embolization. Uterine artery embolization was started by actually a gynecologist who wanted to embolize fibroids before doing surgery. So weeks before, the gynecologist took the patients in to do embolization before the surgery. But a lot of these patients canceled their surgeries because they said, our symptoms have gone. We don't bleed anymore. So why do we have to go through this surgery? So uterine artery embolization was then established as another line of therapy for patients with fibroids and adenomyosis who did not want surgery or who were contraindicated for surgery. And it became one of the procedures that we did in our IR room. If you can see on the right, that's how it's done. A puncture into the femoral artery, you go into the uterine artery and you inject particles, either embosine or PVA particles, to stop the bleeding or actually embolize the artery, and that will alleviate the symptoms of the patient. Now we, of course, in usual manner, we have to do a study for everything. So therefore, we did a small little study, but the figures were very good. About 50 patients we did in 1 year follow-up. 56% of these patients had 50% reduction in volume measured on MR at 1 year. And these are some of the pictures. They're quite old, but if you see here, that is actually a fibroid, and complete absence of the fibroid after a year. That's another patient, and again, after 1 year, the fibroid has disappeared. Now we have, these are my papers from IR that were written and collaborated with all my collaborators. But I would like to highlight that on the top, the Hong Kong Journal of Radiology was my first ever journal, written in 2003, which was fine needle aspiration biopsy in the diagnosis of histoplasmosis of the adrenal glands, written with Prof. BJ and Prof. SB Chan. Now came the MR-guided focus ultrasound. What is this? Again, it was targeting fibroids and adenomyosis, but without any invasive procedures. We don't have to puncture anything. Patient just lies in the machine. Combination of MRI and ultrasound. The ultrasound beam comes from below the MRI images, and we were able to burn fibroids and burn adenomyosis at that time. Again, Prof. BJ brought this machine to our shores in 2010 through a grant, and we started doing cases. So this is how it actually looks. It's ultrasound, so it's a focal beam of ultrasound that comes in, and we can burn the fibroids and adeno, and that's the result of what you get. We had this. I'm just highlighting two patients here, pre and post. This is adenomyosis, very classical. The gynecologists here will know, posterior wall of the uterus, and that's how they looked post after 6 months. This patient actually went ahead to have twins after this procedure. And this is a chapter in a book that is co-written myself, Dr. Waylin, and Dr. Eric. Another procedure close to my heart is fallopian tube recanalization. I remember attending a lecture by Anne Roberts. And in that lecture, she said, IRs are able to put in a guide wire through a vessel, through a ureter, through the biliary tract. What is a fallopian tube? It's smaller. Just make sure your wire is smaller, that's all. So we started this, again, a very small study, to see whether it was feasible to carry on. And we managed to actually, out of 9 patients, get 4 of them pregnant and 2 of them to full term. The parents are very happy to share these pictures because they're 8 years infertility, both of them. This next slide is a precursor to breast imaging. As we all know, breast cancer is the most common cancer in women globally. If you look at both these images, the top talks about global incidence of breast cancer, and the bottom is global mortality of breast cancer. And we can see that over the past 4 decades, high-income countries have actually decreased their breast cancer mortality by 40%. So the WHO Breast Cancer Initiative is to reduce mortality by 2.5% annually, which means that by 2030, we will have a 25% decrease in breast cancer, and by 2040, a 40% decrease. This is by early detection and very good treatment. And in our country, we have about 60 plus breast surgeons, 10% of whom are in this room today. Thank you, guys. So going on to breast imaging, if you look on the left, that was Albert Salomon. He realized that by taking radiographs, just a normal X-ray of the specimens that he had taken out of patients, breast specimens and lymph nodes that you can see over here, he could actually see something. And then came Stafford Warren. Stafford Warren was a doctor in the army on a boat, on a ship in the US Army. And his job was actually to do screening chest X-rays for all the army personnel on the ship. So of course in the army, there are also women. And when he did the chest X-ray for all these women, he noticed the breast. Surprise, surprise. And then he realized, fine, we can actually image the breast. So finally, very much in the year that I was born, actually, in 1967, what we know today, or rather the beginning of mammogram came about. By adjusting milliamperes and kilovolts, the mammogram came about. And the father of mammography is Robert again. And at that time, you know, we used to wash film, and that is how it was being done. So if you look at the time, if you look at the time that I first started working here, this is how we used to process film, guys. A cassette on a mammogram, on a mammo machine, in a film processor, in a dark room, and then we moved on to digital, and today we have the tomosynthesis. The tomosynthesis is simply this, where you have multiple slices of the breast, almost like a CT scan, but not that many pictures. And if you look at this, you can see how it is different. You can see that there's something there, but when you go through the slices, you can see that the cancer really comes out at you. It increased the confidence of the radiologists to report for their breast surgeons, and the tomosynthesis is excellent. Now, breast intervention as well. Dedicated breast biopsy needles were introduced very much in the 20th century. And if you work in a hospital, you will know that these are the sort of breast biopsy needles that you will see all the time. The ones on the right, they are the semi-automatic and automatic breast biopsy needles. We use them not only in the breast, but even in lung biopsies and in liver. Now we moved on to the vacuum-assisted biopsies. These are all different machines in no order of preference, but this is what we use in this institution for our mammogram biopsies of microcalcification. You see, when you have microcalcification in a mammogram, what you want is to make sure that you get a large enough sample that is representative of what the disease process is. And so today in UMMC, we don't use the 14-gauge biopsy needle anymore for stereo. It is VAB all the way, thanks to collaboration with our breast surgeons. This is our first workshop on VAB that we did many, many years ago, and we have been doing VAB from then on. So this is, again, all our papers and our research that has been done under the breast unit with our breast surgeons. Now, I go to part 2. It will be shorter, I promise. You ask me what this is. This is my sister Sasha. And this was her first birthday, 31st December 1975. My parents had gone overseas. They couldn't be around. They had no choice. They had something on and they had to leave. And I was 8 years old at that time. And I thought, how can she not have a first birthday party? That's sacrilege. So my father, who is also the main organizer in this family, by the way, had this huge book, and he had all his friends in alphabetical order. So I decided I will take the book, I will call them all, ask them all to cook a dish, because I'm not going to do that, and turn up. And so they all did, and Sasha had her first birthday party. I think that is the first thing I ever organized, and I don't think I've ever stopped since then. When I first joined the department, the UTC, the Ultrasound Training Center had not existed yet. Now, very early in the 1980s and 1990s, actually, WHO had actually wanted to start ultrasound training in Malaysia and had targeted the university hospital. But due to some problems in Eastern Europe, that was shelved. However, representatives from University Hospital, or UMMC at that time, traveled all the way to Philadelphia, to Jefferson University, and to the Jefferson Ultrasound Education Research Institute, JURE, to sign a memorandum of understanding with them. And the official opening of the UMMC Ultrasound Training Center was done in the year 2000. That's Tan Sri Amin, who was the then UMMC director, together with Prof. Kumar and Prof. Sazila, and that was the UTC. So when we first started the Ultrasound Training Center, these are some of the courses. We started training general practitioners, very small groups. This is our old radiology lecture hall. I think, Ahmed, that's you, at least part of you. I think so. From then on, we moved on to have many other courses, and not only for general practitioners, but also for our radiology fraternity. As you can see up there in the middle is Prof. Anil Ahuja, the person for thyroid ultrasound, Dr. Nitin again. And so we decided to organize courses also for our fraternity. Now, the Ultrasound Training Center underwent a little bit of a metamorphosis, and Prof. BJ at that time again decided to change its name to Continuing Biomedical Imaging Education Center. So in short, it's CBIE. Because he said, let's not just train everyone in ultrasound. Let's do courses for all our modalities. And therefore, we had a full calendar. Every month we did courses. And to date, I was counting, we have done at least about 180 courses under the CBIE umbrella in UMMC. This is another course that we did. I mean, that's you, definitely. You co-coordinated the UTC with me later on. And this is a vascular ultrasound course in 2008. We carried out some of our courses. This is before the pandemic at the top, a women's imaging course. We took it to a large, we became much bigger, holding it in hotels and inviting doctors across the nation. During the pandemic, we didn't stop. We did an online workshop, and we had about 150 participants. They couldn't have any hands-on training, but we did recorded demos. And we had a lot of participants. At the bottom is our latest course done this year in collaboration with our gynae colleagues in Eastern Hotel on basic abdominal ultrasound and basic obstetric ultrasound. Apart from ultrasound, another part that was very close to my heart is vascular access. And I'm very lucky to have been part of the Asian Makova. This is a group of people that multidisciplinary, that look at vascular access and the problems around the world. How we could bring this back to our country and how we could address these problems. And we not only did this at an international level, we actually went to train our nurses. Because I don't know if you, many of you are well aware, a vascular access device is either a port or a PICC line. It is one of the easiest procedures in the IR room, but for the patient, it is a huge affair. It is their only lifeline for chemotherapy. It's their only lifeline for hydration. It's their only lifeline for antibiotics. And so you know, we have patients who have got these pots and they come from very rural areas. If you put a pot that needs to be flushed every week, they are not going to be able to do that. So we need to take all these things into consideration. On the right-hand corner in the middle is some of my first few chemopot patients from Klang Hospital, and that's a Relay for Life walk for cancer. I remember doing one of the first pots in Klang Hospital. At that time, had had a group of students there. We used to go there to teach, and so I got special permission to do a pot. We did it in the barium machine, in the barium room, covered the entire machine with all these green cloth, and under a torchlight of some sort. I have no idea whether it was a torchlight or somebody's phone. I don't even know whether they had phones at that time. But nevertheless, we managed to do a pot. And these are some of the patients who I had inserted pots in. Sadly, some of them are no longer with us. Now, when it came to vascular access, this is bread and butter of radiology. So 10 years ago, I decided to train our master's MOs. We started this course in 2014 because I think everyone wants to learn how to do an ultrasound puncture, but radiology needs to master it. And therefore, our second-year students who just passed their Part 1 exam, not only in by the way, but all over the country, were invited, and in conjunction, or rather in collaboration with our industry partners, we do this course every year till today. And to date, we have trained about 600 master MOs in ultrasound-guided punctures. Puan Ravi Chandrika, my head radiographer who is there, took it upon herself to do a pilot project on PICC infection, because you know one of the biggest things, or rather the biggest problems with lines are either infection or thrombosis. And the pilot project in one of our wards, together and in collaboration with our head of ID, Prof. Sashila, and these are the papers. And it is an ongoing fight and an ongoing battle, but we will get there. We will get to zero infection rate in UMMC, and I'm very sure of that. I'm now going on to the third part. This is the part of me being an educator. But before we move on to that, I would like to you to take an intermission of just a few minutes to watch the stars of my medical education life, my postgraduate students. A big thank you to Doctors Jivita and Fatin and to my radiographer Iqbal for putting together this video, and also to all my ex-students nationwide who sent videos of themselves. Thank you so much. We will now move on to the next part, or the part 3, my life here as an educator. I managed to find this letter, which was my offer letter as a lecturer here in the university. 3rd October 2001, and one of my daughters was passing by when I put this letter up and said, "Mom, you only earn 2,900 ah?" And I said, "Yes, that's why I can't buy you anything, so just ask your dad in the future." Anyway, so my undergraduate medical education life here started in the OSCE team. The late Prof. Rokia and Prof. Christina actually introduced the OSCE into the assessment of the MBBS curriculum in 2003. I was fortunate enough to join this team in 2008. We were responsible for the running of the OSCE exam, but not only that, we were also responsible for teaching, because the OSCE was very new in our faculty. We were responsible for teaching our lecturers how to examine the OSCE and how to be standardized across the board. So we did training of lecturers through workshops, multiple workshops. And in 2010, the OSCE team was the recipient of the University of Malaya Excellence Awards. We look very, very young there, don't we? The team consisted of Prof. Young, Prof. Azura, Prof. Christina, of course, the late Prof. Rokia, and myself at that time. Now, the OSCE team has undergone a lot of changes, and my current OSCE team is seated right in front of me. Prof. Amani, Prof. Zul, Dr. Aizuddin, and Dr. Tianchi. We do the OSCE exam for the MBBS in phase 1 and phase 2, and it is actually a lot of hard work to brief the students, to brief the lecturers, to prepare the OSCE ward together with our staff from Merdu, Medical Education and Research Development Unit, and the Dean's Office as well. And it is a hardest task, but we've been doing this for so many years that now I think it's at spinal level. So it is a really well-oiled clock being run now, and I thank you very much, my wonderful team. I need to talk about the OSCE during COVID-19. We didn't stop, by the way. Just for your information, during the COVID pandemic, our students were not here. They were at home. And some of them were in rural areas where they did not have any internet connectivity. If you look at the top row, that's Amani, Zul, and myself. Before the exams, calling each and every student to find out whether they had connectivity, whether the camera worked, whether they could hear us. And in the bottom, I'd like to say kudos to all the examiners in this faculty who examined during the COVID-19 pandemic, because they had to be both patient and examiner. The students were asking them questions, and they had to examine at the same time. No easy feat, I must say. So this was how we did the OSCE at that time. These are our papers that we wrote, or rather the late Dr. Sim wrote for us for the OSCE team. Now, in 2014, our then Dean, Professor Dato Dr. Adiba Kamaruzaman, was tasked by the Dean's Council to come up with a postgraduate curriculum for the nation. And so together with Dr. David Pitts and the late Prof. Simon Frostick, the arduous journey of coming up with a curricula for all the subspecialties started. It started way then, and you can see the numerous meetings that we had. The radiology writing team consisted of Prof. Rozia and Prof. Raja Rizal and myself from UM, Prof. Faiza from UKM, Prof. Shima from UPM, Prof. Ame from USM, but we also had others from KKM and other universities who helped us with the groundwork. So we had numerous meetings with stakeholders, with the Ministry of Health, with the Ministry of Higher Education, and finally, on the 27th of August 2021, 12 curricula were launched, and the radiology curriculum was one of them. I have come to the end of my talk, but I have a lot of people to thank. I have so many people to thank that have gotten me to where I am today. So I hope you will bear with me while I go through that. Right at the top left-hand corner is Dr. Ranjit, who was a radiologist in Ipoh GH, where I was doing my housemanship. And he was the nicest man, which led me to think that all radiologists are fantastic people. And when I used to go down from the wards with an X-ray film for him to report, he would say, Anusha, don't go up now. Just sit down here for a while, take a drink of water, let me teach you something. You go back to the ward, they'll send you to run for blood, fetch HP report, and so on and so forth. So sit down. And he really did teach me a lot. The second person is Dr. Viji, who couldn't be here today. She works in Gleneagles at the moment, retired from government service. And at that time, when I was a medical officer in Kuala Pilah Hospital, she was the radiologist who used to visit. And I used to follow her to the barium room and watch her do procedures. And it's from Kuala Pilah that I applied for my Master of Radiology in UM. Now come my gurus in radiology. Prof. BJ, who was the head of department at that time when I joined radiology. I was pretty scared of him then, a little bit till today also. And those of you who work with Prof. BJ will know what I mean. Prof. Kumar, who was always my voice of conscience, and I think till today I can still hear him going, Anusha. Prof. Ng, who is one of the top 50 medical physicists in the world, and he is here with us today. Taught me so much about radiation protection. I had no idea that medical physics was so complex and so important in our lives. Prof. Fatima, who taught me, who was the first person who taught me all about breast imaging. Prof. Sazila, who was in CBIE before, or the UTC before. Now I come to the gurus who are not in my department. Prof. Siva and Prof. Kula, who are here today. Thank you for teaching me how to be a radiologist to a gynecologist, and I mean that from the bottom of my heart. You never stop teaching, whether it's a gynecology master student or a radiology student like me. And because of you, my interest in women's imaging sparked, and I thank you from the bottom of my heart. The late Prof. K.L. Goh, who was a regular in our department, as he was brothers in arms with Prof. BJ and Prof. Kumar. They used to call themselves the Coffee Club and allowed me to be their mere secretary. It was a boys' thing, basically. But he taught me so much in being a gastroenterologist, in how to image liver lesions patiently, very patiently. Prof. Liam, who is my teacher till today, and I do a lot of cases till today for him, always teaching me. Tan Sri Amin, who was our ex-vice chancellor and ex-dean. Tan Sri, I was very honored to serve under you and still am. Thank you. Now we go on to education. Before I go into medical education, I'd like to first pay homage to Sister Enda Ryan, Datin Paduka Sister Enda Ryan, who was my headmistress in SMK Asunta. She was a 19-year-old nun who left Ireland to come to Malaysia with one aim in her life, and that is to educate young girls. And she started Asunta Primary School and Asunta Secondary School. And her lessons are invaluable. She taught us how to not look at the other person through race, religion, color, size. And you can tell an Asuntarian a mile away because of this. We lost her sadly this year at the ripe old age of 96, and that void is felt by all of us. Then come my gurus in medical education, Prof. Adiba, Prof. Jamuna, the head of Merdu, Prof. Christina, and the late Prof. Rokia, who have taught me and guided me so much in my journey in medical education. On the left-hand side is the Vicom unit, who have been instrumental in getting today sorted out. Everything about today, from the organization to the IT, has run smoothly because of them. The staff in the Dean's Office and the staff in the Medical Education Research Development Unit that I work with very closely, both in the OSCE and the postgraduate. My AJK on the right-hand side. Thank you so much. You would have seen these girls outside getting you registered and sorting out your seats. Thank you so much for your hard work over the past 3 months. You have no idea how I appreciate that. To my Department of Biomedical Imaging, I hope I have put all of you here. I have tried my level best, if you are coming to today, to try and represent all of you. From IR to CT to MRI to memo to ultrasound. I am truly indebted to all of you. We are one truly big family. And I hope that when I retire next year, this continues. On the right-hand side is yet another Relay for Life walk, where we walk under the banner of our department and UMMC. And we do that every year. To my colleagues in radiology, I do not know where to start. There are my ex-colleagues, my junior colleagues on the right-hand side. You are really my family at work, and I thank you so much for everything that you do for me. At the top left-hand corner are the 3 musketeers. Prof. Uzria, Dr. Sumi, and myself. We started the Master of Radiology here together, and we also were lecturers in this department. That was our induction into the Academy of Medicine, which one afternoon we just drove. I think it was 2005, if I'm not mistaken. We just drove to the hotel where we're supposed to get inducted, and all that was left for us to wear were those hideous green gowns. Therefore, you see the 3 of us in that green color getting inducted into the Academy of Medicine at that time. So guys, thank you very much. This is our durian parties. We are famous for that over there. Nazri leading the pack, of course. To my friends, some who have come from afar, I thank you so much for your fellowship. Some of you have known us for more than 30 years and have seen our children grow up. This group on the right-hand side here, this very colorful group that you see here, this is a group that gathers in our house for New Year's every year. And all of you are welcome, by the way. And they have grown up. I mean, our children have grown up. When we started this, our children were kids. And now they're all adults and join us as well. The group above that is my ZFG girls. And this is a group of women, all of us working here, who just found ourselves in a WhatsApp group. And we haven't stopped chatting since. So I thank you for your fellowship and your friendship. My group, my traveling group, we have climbed mountains together. We have gone on boat rides. We have gone jungle trekking. We have gone on trails. Most of them are doctors. And this is so essential that we get away from our everyday work. And we do this just so that we can recharge and come back. I thank you so much. Thank you, Manisha, for coming all the way from JB for this. And I hope that this will not be the end and we will continue to travel. We are traveling actually soon. Yeah. Anyway, I have to give special mention to the women who are like my sisters from another mother. These are the women I laugh with, the women I cry with. Those who I talk to almost every week or every day sometimes. My BFFs, thank you, Gaia, for coming all the way from Malacca. And she brought with her her son, who's also a doctor, Dr. Prashant, who I've carried from the time he was born. That's Dr. Premila over there. We've known each other since we were crawling. Ironically, she became a radiologist as well. Now, the picture below that is my 7th birthday, and that's Premi and me. We've known each other much longer than that. But in the early days, the fashion was to show your frilly underwear, and therefore, the pictures of us at the age of 3 would definitely make sure you don't talk to me anymore. Therefore, they're not up here. So I'd like to thank all of you in this slide for your invaluable friendship and your continuous guidance. It is totally invaluable. To Young and Rosia. Okay, so Nazri did say I was going to cry. To Young and Rosia, I do not know how I would have navigated the past 27 years in this institution without you by my side. For the bad times, for the good times, you're just not even a phone call away. All I need is to tell you that I need you, and you are there. And for that, I'm totally grateful. When Rosia left us, she didn't leave us, she retired. She's here. The threesome became a twosome, not in that way, but we miss her so much. A great void, but nevertheless, we try our level best to meet up as often as we can. I come now to my family. My cousins, my in-laws, from here and those who are abroad, some listening online. I thank you so much. You know, at times of adversity, the word family really means so much because you have garnered around us in a way that I never could have imagined and given us so much love and support, especially when we lost our mom, and for that I will never ever forget. So thank you so much. I am so proud to be a part of your family. I now come to my immediate family. First, I'd like to talk about my brothers on the right-hand side. Ganesh and Ramesh, they are not here. They are settled in Australia. The 4 of us created loads of mayhem, led by Sasha, of course, the youngest, but the team leader no less. And then at the top is my Anoy. She walked into our house in 1961 to ask my parents whether she could work with us, and she never left. She was a second mother to Sasha and myself. We lost her, and she passed away in 2016, but she is forever in our hearts. My brother-in-law, Edwin, I thank you so much for marrying my sister and joining our family. You are a wonderful uncle to my children. Sometimes they actually call you instead of me and their dad. But that's only because of your selflessness and the way you give so much. To my 2 little shining stars, Ariana and Darren, you have brought so much joy to this family. Darren is 10 today. Happy birthday, Darren. But he has sacrificed his birthday to listen to me drone on for 1 hour. To my family unit, Papa, my father, who is 93 this year, not yet, I know, but you were a fabulous father to 2 children. I could never understand how, at least now I don't, that I'm a parent. When I used to call you at 9 o'clock or 10 o'clock at night and say, Papa, I need a ruler or a pencil for tomorrow, he would turn up with it. If my children ever asked me for a ruler or a pencil at 10 o'clock, I would tell them to go to sleep. So I thank you so much for being a fantastic father to both of us and a grandfather to all 4 of your grandchildren. It must have not been easy to be a single parent over the past 14 years, but you have kept this family together, and for that, you have my heart. My sister Sasha. I was an only child for 7 years. And when God gave me a sibling, He gave me the best. Sometimes I wonder who's the older sister and who's the younger sister. My day is not complete if I don't talk to her. She is my pillar, my rock, my conscience, my everything. And I love you so much. Now we come to my soulmate. We started on this journey when we were just 18 years old. And we are still on this journey. There have been many ups and downs, but nevertheless, I would not do this journey with anyone else but you. I've tried to capture your essence. We do a lot of outdoor activity together. But I want to take this time to tell you that I'm truly, truly proud of what you have achieved in your life professionally. We started the master program in '97 together and graduated in 2001. You went on your journey and I went on mine. But you have proven to be a fantastic gynae oncologist, and for that, I truly applaud you. Now come my two daughters, Vinosha and Sitara. The picture taken on the left is when we were in Glasgow, when they were playing with snow. And I've watched them grow. The picture on the right is actually one that they'd taken many years ago, and one they took just last year outside our house in Glasgow, because they visited it again. I think what every parent wants for their child is for them to just do well in life and for them to just be good people. And I think your father and I have done a very good job with that. I'm so grateful that you are two bright young women with your heart in the right place. I wish that your dreams are all achieved, and I wish for you to make your own path, make it your own, and have fabulous time while living that life. This is my last slide for today. And one of the reasons why I chose Portrait of a Woman is also because I wanted to dedicate today to my mom. She was a secondary school teacher, maths teacher. She was one of the strongest women I know and worked tirelessly to give Sasha and I a life where we would not want for anything. She loved music. And when she passed away, we sang a song for her. I hope you will bear with me as I invite Sasha up for us to sing this song for her again. The words of the song are at the back of the book. If you have lost someone dear to you, this song goes out to you too. Please bear with us as we try and navigate this for you. Mama, you gave life to me, turned a baby into a lady. And Mama, all you had to offer was a promise of a lifetime of love. Now I know there is no other love like a mother's love for her child. And I know that love so complete, someday my sleep must say goodbye. Goodbye's the saddest word I'll ever hear. Goodbye's the last time I will hold you near. Someday you'll say that word and I will cry. It broke my heart to hear you say goodbye. Mama, you gave love to me, turned a young one into a woman. Mama, all I ever needed was a guarantee of you loving me. 'Cause I know there is no other love like a mother's love for her child. And it hurts so that something so strong someday will be gone. Must say goodbye. Goodbye's the saddest word I'll ever hear. Goodbye's the last time I will hold you near. Someday you'll say that word and I will cry. It broke my heart to hear you say goodbye. You've always been there every time I fell. You are to me the greatest love of all. You took my weakness and you made me strong. And I will always love you till forever comes. Goodbye's the saddest word I'll ever hear. Goodbye's the last time I will hold you near. Someday you'll say that word and I will cry. It broke my heart to hear you say goodbye. Till we meet again, until then, goodbye. Thank you very much.
Thank you. Thank you very much, Prof. Anushya, for your inspiring lecture and heartfelt song. Ladies and gentlemen, I would like to re-invite our Dean, Professor Dr. Yang Farida, back to the podium to summarize and conclude today's inaugural lecture.
Okay, let me gather my thoughts and my composure. That was tough. But I would like to add to the cooking. She can also sing. And she also plays the piano beautifully. And she must be the only 7-year-old that welcomed a younger sister, because I never did. In essence, the portrait of a woman, I think, is a tapestry of a journey of Anushya, Professor Anushya, as a clinician, as an organizer, and as an educator. As a clinician, she brought us through the journey of the vaginal A scan, and I think the women in this house kind of clinched for a while. She brought us on a journey of Doppler as well as a journey of the shear wave elastography. She brought us into the journey of fibroid intervention, and we remarked that only people at University of Malaya will say a cohort of 50 patients per year is a small number, because, that's how we roll. 50 is a small number, not big enough, only at University Malaya. She also brought us through MRG FUS and through fallopian tube canalization. And she mentioned at that time that they helped impregnate 4 women. I don't think they meant they did it, you know. She also brought us through breast cancer and the evolution of biopsy. As an organizer, she took us through Sasha's first birthday party, through Jure and CBIE, as well as to our continuous effort in trying to reach zero infection rate at University Malaya Medical Centre. And as an educator, she shared with you our trainees. Obviously, the trainees in UMMC were all Sharia compliant because all the girls took picture first and then the guys. They didn't mix. But we don't roll like that because, you know, Nazira, who is an Asunta girl, does not discriminate between gender, right? And she brought us through OSCE, for which I was part of the OSCE journey in the beginning, so that was very nostalgic for me too. And she also brought you through the National Postgraduate Medical Curriculum, a very, very important and I think significant evolution in curriculum for Malaysia. But the themes across these lectures, I felt, was number one, like Anushya, we should all explore all areas of interest as long as we have the proactiveness and the dedication and the tenacity to do it. Number two, like Anushya, you need to seek these opportunities with support for your training path and cultivation of your innovative ideas. And that can only happen at Faculty of Medicine, University Malaya. I've got to do some pitch for the faculty. Thirdly, fundamentally, it is a story of paying it forward. Whatever training and knowledge we receive, it is imperative and actually part of our oath as physicians to teach and train our future, exactly what Anushya has shown us through her journey today. And lastly, ultimately, it is about the collage, creating a portrait of the love of a woman standing here on stage. Anushya, Professor Anushya, I'm sure your mother is very proud of you, as all of us are very, very proud of you. Congratulations, my dear friend.
Thank you, Professor Dr. Yang Farida, for chairing this inaugural lecture today. And thank you, Professor Dr. Anushya, for your wonderful lecture and presentation. Moving on, there will be a short photography session. They've already started. So I was supposed to say, yeah, okay, they're doing it already, so that's fine. All right, thank you. The next group of people that we would like to invite is Prof. Anushya's family members to the stage for a photograph. Please. Aizat, tolong susun. Smile. Thank you very much. Okay. You want to take facing everyone? Okay. One last photo is everyone, but not down here. I think we're going to face that way. Okay. Yeah. Okay. Try to move towards the center. You can see up to maybe 3 rows on the medial side of the lateral thingies, okay? You can fill up the walkway as well. Yeah, collimate, that's what we call it, collimate. Okay. Bawah pun boleh.
Berdiri. Kalau duduk tak cantik, rendah nampak.
So,
Orang semua
berdiri.
berdiri.
All right. I've been told by Mr. Photographer that standing up makes for a better picture. So, that. Oh, it really does. Okay. Huh? Yeah, don't worry. I'm going to scoot somewhere. Okay. More medially. How you think? Wiro? Okay, move along.